I got into all my top choices, including one PA school that is in the top 10 in the nation. So if you want to get the key to life, listen very close. What's good? What's happening? My name is Trauma, aka Chianse. Welcome back to my channel. If you haven't already, make sure you are subscribed and you have clicked the notification bell below. From the title of the video, you see we are going to talk about the MMI. I know so many people who get scared by this term, and if you're not familiar about what the MMI is, it's the multiple mini interview. So there's two types of interviews. There's the traditional and the MMI. You'll often see these two interview types when you're applying to PA school, med school, nursing school, pharmacy school, anything you name in the healthcare field. They may have this type of interview. As opposed to the traditional way of interviewing is when you go through rotation, and in each rotation, you're gonna be with an interviewer. You may be given a brief instruction or scenario that you'll get to read and review for about 1 to 2 minutes. After this time is up, you're gonna get about 5 to 8 minutes to respond. Now, this 5 to 8 minutes is usually you presenting yourself to the interviewer with how you thought through the question or instruction. I know this is a part that gives a lot of people the heebie-jeebies or gets people a little anxious because you are literally talking for about 5 to 8 minutes with very minimal back and forth. It's not like the conversation style that is usually seen in the traditional version. I'm here to give you an easy 7-step framework that helped me with getting accepted to every school I interview with. I got into all my top choices, including one PA school that is in the top 10 in the nation. So if you want to get the key to life, listen very close. Just a disclaimer, of course, this is just a framework that helped me. I encourage you guys to do your research, search up other videos and methods that people use and see what works for you. I strategically named these and started them all with the same letter, the letter P, just so it can make it easier for when I'm going through the steps. So to name all the steps, you have step 1, position, step 2, primary concern, step 3, problem and task, step 4, pimp the past history, step 5, process, step 6, present, and step 7, prevent and follow up. Now, I will say these 7 steps are probably more tailored to scenario-based questions, which are questions that you're not always gonna get. Sometimes you get a question asking about yourself, or you may get a question that causes you to critically think about some data presented to you. Whichever it is, use these steps and cater it to the question. The main thing I wanna say is you wanna practice MMI questions. I'll link below in the description a couple references and resources I use. I feel like the main thing that helped me are the 200 MMI questions that BEMO, B-E-M-O, they provide as a resource. If you have any questions, concerns, or any kind of confusion, don't be afraid to leave a comment below and I'll be able to clarify and answer all your questions. Without further ado, let's get into the steps. 1, position. You want to identify what position are you in? What role are you playing? Are you the provider? Are you the concerned family member? Are you the concerned best friend? Are you the manager? Are you a worker in the store? Sometimes it helps to also understand the setting that you're in because that plays a role in what kind of decision making you need to make. Step 2, primary concern. This is the part where I take into consideration their well-being. Is the person okay? Is there anything critical? I think about all aspects that could be affected, such as mental health, physical health. What problem is being brought to me? Is it a decision-making problem? Is it an ethical dilemma? Is it data needing to be analyzed? This is the part you want to specify what is the primary concern. Step 3, problem and task. Now, step 2 and 3 can kind of be mixed. I hope this part isn't too confusing because primary concern can also be seen as you identifying the problem in a sense. Of course, when you're going through these scenarios and questions, you don't have to do like a step. This is just a framework to help you think through the question. So around the time that you're trying to understand what the primary concern is where you can also start thinking about what the problem is. So for step 3, problem and task, you want to assess exactly what is wanted out of you. This is the part where I also get the juices flowing as far as where I can help. And I also start thinking about the alternatives. One of the most important things as a future healthcare provider is being able to critically think how to solve the problem and also take into account opposing alternatives. This is also the part where you decide, yes, I'm helping this person decide between 2 options, or this person needs help with finding resources. Step 4, pimp the past history. In this step, non-judgmentally, you want to be able to gather all the information you can to help you solve the issue or present whatever you need to present in your answer. If it's involving somebody's health or a patient, you want to take into account the condition that they may be having. You also want to think about underlying conditions that can come about from the primary condition. This is the part where you want to ask all your why questions. Because this is hypothetical, you want to ask all your questions with if-then statements, such as, is the patient's life at stake with this dilemma? If the patient's life is at stake with this dilemma, then I will so-and-so. Or if my best friend chooses the first option, then this and this will happen. This is also the time where I'll include all possible options. The fact of the matter is that some problems don't always have one single solution. By you listing out all the possible options, it shows the interviewer that you know this. Step 5, process. So in this step, it's really you just processing all the information you gathered through understanding your role, the setting, and the problem to now give multiple explanations for why it might be happening and how it can be solved. This is the part where you can show your empathy, your compassion, how attentive you are. This is the part where you can say how something is working, how it may not be working. I do want to stress you don't want to jump to conclusions. Continue using if-then because this is hypothetical. You don't actually know what the result is or will be. You also want to be sure that you remember all perspectives involved. Step 6, present. So for present, you're basically presenting everything that you thought through. You're laying out all the solutions you have and explanations. You're using all your extracted information to guide the direction of how you're answering the question. You're providing and giving possible resources because sometimes you're not always going to be the sole resource. Realistically, sometimes the role you play is to direct someone to the resources they need. Lastly, you can involve outside necessary people that would help with solving the issue. This is helpful in those scenarios where you may need to direct someone to the CEO or someone above because you understand that in their role, they're limited as to what they can really do. Number 7, prevent and follow up. So if applicable, and it usually is, discuss how these solutions you provided can impact future situations. You want to come up with ways that can prevent this problem from happening in the future. Now, this may not be applicable if the question is asking about yourself or if it has to do with some data presented like I mentioned earlier. The follow-up portion is basically just checking in. It's nice to include ways that you would follow up with the situation because think about it. Whenever you help someone with any problem or you think through a situation, you want to stay updated with how that advice or solution helped the person. Has there been progression? Did it help? Did it not help? Especially for the healthcare field, this part is important because this is what we do with our patients. After providing the treatment plan, we make sure that the patient follows up so we can see if they're getting better, if they're getting worse. All right, y'all, so thank you so much for listening. Those are the 7 steps of the MMI framework. Please let me know if this helped you out. I also found that this can be very applicable to whenever you do the CASPer test. If you're unaware about what the CASPer test is, it's an online test that is all scenario based and it requires you to type your response in a timely manner, so it's kind of chaotic. But I found the MMI framework really helped me with anything scenario based. Again, make sure you do your research so you can also know of the methods that help with non-scenario based questions. Thank you for watching to the end. Don't forget to subscribe, hit the notification bell so you can be VIP to see my next video. No long talk. I'll see you guys in my next video.